Friends, I'm Jyoti Hikar and today I'm going to talk about the different sources of adverse events. So let's start. Firstly, we see the what is adverse event. The adverse event is any untoward, unfavorable medical occurrence or medical response in a patient or a clinical investigations subject administered a pharmaceutical product, and which does not necessarily have to have a causal relationship with this treatment. As per ACH, it to be a guideline. An adverse event can therefore be any unfavorable and unintended sign, including an abnormality, laboratory findings, and then symptoms or disease. Then unwanted effect. It means it includes the symptoms like headache, nausea. Then physical findings. It includes the elevated BP, lump, pallor, and edema. In abnormal lab values, it includes the increased liver enzymes and decreased hemoglobin. Then overdoses is important to define what percent cut off to be taken as an adverse event. Then adverse event can be unfavorable deviation from baseline health, which includes first worsening of condition present at onset of the study, patient deterioration due to a primary disease. Then second one is a patient intercurrent illness, and then third one is the event related or possibly related to a concomitant medications. For example, the unfavorable deviation from a baseline health, which includes the first headache present at baseline was a mild, now become a severe. Then second is a worsening of a condition present at onset of the study. Then unfavorable deviation from a baseline health, which includes the first patient deterioration due to a primary disease, and then BPS studies, antibiotic studies, and then we see the examples. First is due to concomitant medication hypertension trial, PT comes with the diarrhea, interrogations, had taken antibiotics, and because of URTI. then and then we see uh, uh, the sources, different sources of adverse event reporting. First is unexpected adverse drug reaction, in which it is an adverse reaction. The nature or severity of the reaction is not consistent with the applicable product information. For example, the investigational brochure for an unapproved investigational medicinal products. Then our second one is a serious adverse event or a reaction, any untoward medical occurrence that may dose in result in a death. It is a life threatening, requires inpatient hospitalization or prolongation existing. Then hospitalization results in a persistence or a significant disability or incapacitance, and is a congenital anomaly, means a birth defect. Then our next one is a suspected unexpected serious adverse reaction, in which the serious unexpected adverse reaction is one, the nature or severity of which is not consistent with the information in a relevant dose documents. Then the second one is the seriousness, intensity, relationship of drug, expectedness and unexpectedness. In A serious adverse event or a reaction is any untoward medical occurrence that at any dose result in a death, life threatening, requires inpatient hospitalization, result in a significant disability or incapacity, and important medical event judged by investigator. The then the life threatening adverse event. The life threatening adverse event, the definition of this is any adverse event that take place on the patient or the subject in the view of the investigator at a immediate risk of a death from the reaction as it occurred. The does not include the reaction that had it occurred in a more severe form, might have a cause death. Examples: pacemaker failure, then gastrointestinal hemorrhage, infusion pump failure, excessive IV fluid dosing, toxic drugs level. These are all the examples. Then we see the disability. Then in a disability, the substantial disruption of a person's ability to conduct a normal life functioning, significant, persistent, or a permanent change, impairment, damage, or a disruption in a patient functions, structures, physical activities, or a quality of life. The examples of a disability are stroke, loss of limbs, toxic drugs levels, hearing loss, and blindness also. The other examples of serious adverse events are important medical events. Example of such events are intensive treatment in an emergency room, need hospitalization. Uh, then we see the intensity. The intensity and the severity of adverse event are classified according to WHO, that are mild, moderate, and severe. The examples of these are dizziness, non-serious adverse events with a mild intensity, myocardial infarction. All set. Thank you.